Hey everyone, Dr. Alex Ritza here, downtown Toronto Chiropractor, and it is 12:30 on Monday, and this is episode 1 of our Facebook Live show. The name I still do not have, so I would love some input from people on what I should call this baby. We're going to do a live show around 12:15 to 12:30 every Monday to catch people on their lunch break, whether you're downtown or elsewhere, to try and give you some useful information to make your health that much better. Wellness-oriented movement, nutrition, thought, and power. And so today, episode 1 is why does my blank go numb? And what we're going to talk about is pins and needles and the numbness and tingling that I know a lot of people get when either they wake up from sleeping, when you're sitting down for too long at the office, or maybe on the john. Or doing other things, whether you're cycling and you're in the saddle for too long. We're going to talk a little bit about that today. So anytime that somebody tells me they have numbness and tingling, sharp shooting pain or burning, I know that that is an issue related to the nerves and the nervous system of the body. So we know that when the nervous system is affected, it's going to set off a particular set of symptoms, and they are usually pins and needles, numbness and tingling, burning, or sharp shooting pain. And so to answer the why does my blank go numb, we need to talk a little bit about the nervous system. So we know that the nerves that leave from the brain down the spinal cord and branch out into the limbs of the body, they carry signals from the skin, from the organs, from the muscles, back up to the brain, and then based on whatever the brain detects, it'll send some signals back out. So if there's food in the gut, it senses that, it sends out some signals so that we can release the right chemicals to digest it. And if you have a pin or a flame that touches your finger, your body sends out a signal to the muscles to react to it. So we know that with numbness and tingling, that relates to the nerves. And what is usually happening is there's some sort of either mechanical or chemical compression or effect on that nerve that's interfering with the flow of signals back and forth along the nerve. So signals are not going up to the brain as well, and signals are not coming down from the brain as well, and the sensation that we get is the numbness and tingling. So anytime that happens, we know that the nerve is being affected. And in terms of the nerves, especially the ones that go into the limbs, they have a pretty long and tortuous journey. They leave a really, really small hole in the spine and then travel through a bunch of muscles through the shoulder or through the buttock, and then travel through some even smaller holes through muscles to go down to their final destination in the fingertips and down into the toes. So there's a lot of different places where the nerves can be affected, and a lot of places where the numbness and tingling can be generated from. So in some cases, the numbness and tingling is all coming from the spine, whether it's irritation in a joint, literally a disc pressing on nerve, or some sort of nerve leaves through is really, really tiny. If the hole is really tiny, then there's not a lot of room for air and error, and the nerve can be compressed either a little bit or a lot, and then we feel that numbness and tingling. And we know the signals that the nerve are carrying, it's not doing its job, it's not getting there, and it's going to affect our health in some way, shape, or form. So I'd say for the most part, most cases of numbness and tingling, they usually result from the spine. And it's usually that irritation in the neck. And it doesn't have to be from osteoarthritis. It can be from irritation or inflammation in a joint, causing some reflexive tightness in the area, and then that irritation in the joint and the tightness in the muscles around the nerve can kind of constrict it or put some chemical pressure on it, and then you get the numbness and tingling. So for the most part, like, getting numbness and tingling is a really normal and healthy process. Like if I sit here and tap my foot underneath my butt, which I don't recommend, if it sits there for long enough, I won't be able to feel my foot and I get to walk around the apartment. It'll be kind of funny for about 5 minutes. And it's the same with sleeping. Like you could have the healthiest of spine and the healthiest of necks, but if I sleep with my arm underneath my head like this for a couple of minutes, or in some cases a couple of hours, you're going to wake up and you're not going to be able to feel your fingers. So if you compress a nerve, it's going to lead to numbness and tingling, and in some cases it can be normal, and some cases not so normal. Now, what I want to talk about is the not so normal cases, of course, because that's what people are worried about. So if it's normal to have some numbness and tingling with compression of a nerve, we have to define kind of what's normal and what's not. So it's all about tolerance. So if you have a really, really healthy spine and nerves that move nicely through the muscles and muscles that are not too tight, then you're going to be able to put a lot of pressure on those nerves before you get numbness and tingling. But like a lot of patients that we see, they have a lot of irritation and postural distortion in the spine because of work and bad posture and sitting in a desk all day. They have tight muscles and they have irritated nerves already because of a lack of sleep, anxiety and stress, and maybe not the best diet. So if you have an unhealthy spine and tight muscles and already irritated nerves, it's not going to take very much stress to put enough pressure on that nerve to cause numbness and tingling. So as an example, let's say that we have a patient, I love taking care of, John, who was telling me that he would get numbness and tingling just from grasping the subway pole on a subway ride. And 100%, like, this is not normal. Every human being should be able to do this. So I knew that because it was John's radial nerve, I know to check some points into his elbow, some points in his shoulder, and some points in his neck of where there might be some compression. So when I checked his body, it was mainly in the elbow. The muscles around that nerve were really, really tight and irritating it. And then also the spine, if you put your finger right on where the nerve left the spine, it would cause that numbness and tingling just to project down his arm. So I knew in that case where he was having his symptoms, some numbness and tingling, was not actually where the problem was. The problem was in the spine and elsewhere in the muscles. So when we were able to go in and correct that, the numbness and tingling went away, and with a few extra adjustments, he hasn't had that numbness and tingling come back and can grasp onto that subway pole all day long as much as he wants, because we actually fixed the underlying problem of where that nerve was being compressed. So in terms of some fixes for you, there's always two ways to look at it. One is reducing the mechanical compression on the nerve, and the other one is making sure the nerve itself is as healthy as possible. So with the latter, making sure the nerve is as healthy as possible, that's where things like diet come in, and making sure you're getting all the vitamins like vitamin B6 and vitamin B12 and also some of the cofactors that make the nerves actually function at their best. And then the other one is nervous system care, where you're getting enough sleep, you're meditating, you're making sure your anxiety is low so that the nerves themselves are not overstressed and too sensitive. And then the first one, the most important thing, is making sure that the nerves themselves are not being compressed. And that's where stretching comes in, making sure you're doing really good spine care, foam rolling the spine, doing your cats and camels, getting up and stretching every half an hour at your desk and changing positions every 10 or 15 minutes. And then making sure that your spine actually functions properly, and that's where getting your spine checked and corrected by a chiropractor is really important. So next week what we're going to talk about is some actual fixes if you're having some numbness and tingling more than you think you should be having going into the arm. And we're going to talk about some nerve flossing, and that's where we get in and make sure that the nerves can move in between the muscles really well, and can also move in and out of the spine really well. If anyone has any questions about what we talked about today, just leave a message in the comment section. And if anyone has any suggestions for what I should call this Facebook Live show, I would also love some feedback. So we'll see you again next Monday between 12:15 and 12:30 for our Facebook Live show. I hope you got something out of this, and if you're experiencing that numbness and need a little bit more help because you think there's something wrong with your spine and body, then just private message us or call us at Park Road Healing Arts. And I look forward to seeing everyone next week. Thanks. Oh, technical difficulties.